then coming to diabetes, a topic very close to my heart. I don't know if my audience know, well, some of my audience know me already. So I'm a type 1 diabetic. I wear a CGM. So I wanted to ask you about CGMs. I know you use them in your practice to help people or to support patients to help them see their blood sugars or the way they react to certain foods.
Yes.
How do you use CGMs and who do you use them for? I know you wear one, don't you, occasionally?
Yes, I do.
Even though you're not diabetic. So.
Correct. So what we know is one of the earliest hallmarks, one of the earliest, kind of markers of poor metabolic health is a altered response of your blood sugar to foods. And, that's again reflected. One of the official measurements of metabolic health is your fasting blood glucose level. But it's important beyond your fasting blood glucose level because, when we go and we get our blood drawn for a fasting blood glucose, that's just telling us what our glucose is at that moment. Doesn't tell us anything about the 99.9%, of our existence outside of that moment. So the reason I find the continuous glucose monitor so helpful is because it shows people in real time their reaction to the foods that they're eating. And for the most part, foods that are not going to be metabolically healthy, one of the things we know about them is that they're going to raise your blood sugar. And more so, we know that people who are metabolically healthy versus people that are not metabolically healthy are going to have different reactions to the same foods. And we're looking at things like how high your blood sugar goes after you eat a certain meal. And we're also looking for how long it stays elevated after you eat a certain meal. And, what the sort of general pattern is. If throughout your day, your blood sugar is constantly going up and down, up and down, up and down, we know that that is a very harmful pattern, as opposed to someone who maintains a pretty, flat line of their blood sugar throughout their day. And I think that is one of the best, kind of real-time measurements we can get of metabolic health is the CGM. So I use CGMs a lot in my practice, mostly in non-diabetic patients, because, most of my patients are not diabetic, although I do have a lot of diabetic patients, and I use it in both populations. And I think it's helpful in a couple of, situations. When people are first starting kind of along their journey to metabolic health, and they need that, clarity, they need that feedback as to what foods they should be eating and what foods they should be avoiding, the CGM is very helpful for that. And they also start to learn, that sometimes it's the combination of foods. This food by itself maybe doesn't do much, and this food by itself doesn't do much, but when we put those foods together, it has a whole different effect. Or if I eat, one food before another, sometimes that's a different effect than if you switch the order around. So, learning things like that is very helpful with the CGM. And then I think as you get further and further into your metabolic health journey, the CGM can be, again, good feedback to show you how you're doing. Because maybe foods in the past that, you weren't able to tolerate, now that you're metabolically healthy, you can tolerate that. So for me, for instance, I know at this point that I can have some blueberries, and I don't see much effect in my blood sugar. But people who are metabolically unhealthy have that same amount of blueberries, and their blood sugar shoots through the roof. And, this is giving us an indication about underlying metabolic health, and that's why I find the continuous glucose monitors to be so helpful.